I welcome you to the issues where you can be a part of this broadcast from anywhere all over the world via our website www.ikd1061fm.ng. That is www.ikd1061fm.ng. Today on the issues, we will focus on the International Day against Substance Abuse and Illicit Substances. That is substance abuse and illicit substances. This is a day that is recognized all over the world by the World Health Organization. WHO has set aside this particular day to ensure that everyone out there should have a proper awareness as regards what we call substance abuse. And today we will have this conversation at length with our doctor with us in the studio in person of Dr. Kanu. He has actually graced this particular program some times ago, and it's good to have him again with us in the studio. We would have this conversation together. I am Opayemi Ade Bambo, and 16th of 26th rather 26th of June every year is the original day that has been set aside, for the International Day against Substance Abuse and Illicit Substances. So today I would crave your indulgence to sit back, relax, and be a part of this beautiful segment on the issues. So much to learn. As a matter of fact, the President of the Federal Republic of Nigeria yesterday, being Wednesday, actually joined the campaign too as well, saying that he also is in support with the NDLEA in order to ensure that we bring drug abuse to the barest minimum in Nigeria. So I can tell you for a fact that we have so much to talk about. We go on a very short breather. When we return, we get talking proper. Good morning. And today we will focus more on investing in the prevention. Like they say, prevention is far better off than cure. Let me say a very good welcome to my guest today, a friend of the house, Dr. Kanu, a medical expert. Good morning, sir.
Good morning.
It's good to have you again in the studio.
Yeah, it's good to be here.
Thank you for joining us.
Thanks for having me.
So today we're talking about this very important day. I must tell you that yesterday I strolled down to your facility, General Hospital Ikorodu. I saw the campaign, I saw some of your doctors, the agitation and all of that. It was so beautiful to witness. So tell me, for you, 26th of June every year, how is it like for you? Let's start up with this International Day and the essence for this day.
Yeah, because the World Health Organization, WHO,
Yes.
has recognized that drugs, as psychoactive substances, have and their use are causing a lot of problems we are witnessing right now in the world. And by convention, it was now agreed that 26th of June every year should be used, in what is termed as an International Day against drug abuse and illicit trafficking, or simply World Drug Day.
Exactly.
Because drugs are at the roots of immeasurable human suffering. People don't realize that. Drugs eat away people's health and well-being, and overdoses of drug kills hundreds and thousands of people.
True.
The world over every year. And another aspect of it is that there are people who make money off this, the human suffering. There are two parts to this. International Day against drug abuse.
That's the first part.
Yes, and illicit trafficking. Okay, I'm essentially here to talk about the first aspect. It has to do with the individuals who are abusing these drugs,
Those consuming them.
Yes, and are suffering because it's wrecking their body, and physically, mentally, psychologically, and otherwise. And then is affecting the areas of functioning, is affecting their finances and those of their loved ones.
Thank you very much for that clarification, Dr. Kanu, on this particular International Day by the World Health Organization. Now, the president of the Federal Republic of Nigeria, President Bola Tinubu, I want to know your own opinion. Now, this is on the lighter part before we get down to the medical part of this conversation. Mr. President, yesterday, said he's giving his total support to NDLEA in order to fight against drug abuse and drug trafficking in Nigeria. And then he said something that is making a lot of Nigerians ask questions that they want to totally eradicate drug abuse and trafficking in Nigeria. So for you, Dr. Kanu, do you also think that Nigeria could get to a point or would get to a point where drug abuse will become a thing of the past? Do you think it's possible?
Well, that's utopia.
Mm.
We are aiming for utopia,
Mm.
even though, well, I won't say here and say it's not realistic, but
Okay.
the aim is to reduce it to the barest minimum,
Mm.
which is possible. Okay,
Mm.
creating awareness of the problem.
Mm.
Now, the aim coming
Okay.
the aim of this year's 2024
Yes.
um, World Drug Day
Yes.
is the evidence is clear.
The evidence is clear.
Yeah, invest in prevention.
Mm.
I will say answer your question. You say
Yes,
your
please.
personal note.
Mm.
Invest in prevention. So when somebody hears invest in prevention,
Mm.
okay, they may not individualize it as it were. They may
Mm.
think, okay, is for governments at all levels, okay, for they make policies, they make this.
Mm-hmm.
We're talking about President Bola. There
Yes.
are a lot of things that government can do,
Mm.
inform policies
Mm.
that could at different levels, okay, that could affect drug taking behavior of Nigerians,
Mm.
okay, and then even also that will help those that are already exposed, those that already have issues of drug,
Exactly.
to help in their rehabilitation.
Mm.
And a lot of things depends on government,
Mm.
but there are individual aspects, okay.
Mm.
Policies. Now, if you check at the policy, they are telling us that the WHO said the the prevention
Mm.
must be based on scientific evidence.
Mm.
Okay,
Yeah.
in this climb, okay, we're third world where people still believe that, okay, I'll digress. Mental illness is not due to um it's not a medical condition
Mm.
that is due to it's caused by evil spirits,
They
witches,
believe it's
wizard.
spiritual.
Yes. So,
Mm.
but because when somebody most people that continue to use um
Illicit drugs.
drugs,
Yes.
psychoactive substances,
Mm.
both illicit and non-illicit, but alcohol,
Mm. So
which
we are
is
still going to get there.
which is allowed in the society,
Yes, we'll still get there.
will most likely end up
Mm.
with problems.
Mm.
Okay,
Mm.
okay, problems that will develop maybe categorized maybe in two categories. You may say, okay, there are problems that are due to patterns of use.
Mm.
Okay, when somebody is maladaptive patterns of use. Okay, and then there are now problems that are now lead to substance induced psychotic disorders.
Mm.
Okay, so um when people continue using drugs, they will have problems.
Mm.
Okay, they are definitely going to have problems. So, but in terms of policies, talking about generally
Yes.
policies, the government has to do a lot. Okay,
As regards
and
policies.
legal policies.
Mm.
Okay, that's what WHO is also trying to make them understand.
Mm.
Okay, policies as simple as, okay, taxing beer,
Mm.
taxing cigarettes.
Mm.
Okay,
Mm.
because the more expensive they are, it will discourage some people
To buy
from
them.
buying it.
Mm.
Okay, and if
Mm.
they can easily afford maybe 5 bottles of beer, they may take. But if the
Mm.
only one, they may end up with one. Then
It is,
spirits also,
yes.
those are kind of policies.
Mm.
Imports or taxing even their imports. Some
Mm.
of these spirits are not from here. It
Mm.
will affect that. Those are general things.
Mm.
Okay, policies. There are also policies on even those that are ill, that are now, okay, having substance induced psychosis and
Mm.
other psychiatric illnesses due to this. There's some policies, in other climes when people develop psychological conditions
Mm-hmm.
due to these drugs or other things, they more or less becomes the government property, because these ones, their abilities to fend for themselves, you know, is affected, is compromised.
Mm.
So somewhere like UK, they will place them on welfare, okay, so they will
Mm.
not suffer.
Mm.
Here, and especially since the naira devaluation, as it were, most of our drugs are imported. Okay,
Mm.
just like some other drugs, antibiotics,
Mm.
the drugs are so expensive.
Mm.
So people who cannot afford to eat, how can they afford medications? psychiatrists or psychotic drugs and other things, antipsychotics rather, that we use for this. So some of those policies, government can reduce the tax, government can subsidize. There are policies, okay, in terms of prevention, looking at the team,
Yeah.
investing in prevention,
Investing in prevention.
okay, but it's not only for government.
Okay.
All right, it's not only for government because we as individuals have a role to play.
True.
Individuals, okay, like the family is the smallest unit of the society. If okay, two people that come together to start a family are aware that, you know, if they don't, if they know that if they are not careful the way they are raising the children, those children who may end up being wrecked, okay, because okay, they become drug addicts, they will have psychiatric
It
issues.
becomes a way of life for them.
Yes,
Maybe, sorry
I
to
will explain.
interject you there.
Yes.
Sorry. Now, people believe, there is this belief that when you say drug abuse, it is only for people taking hard drugs. And part of what you're talking about, it is not just about hard drugs. Alcohol could be drug abuse and all. Can you tell us in details when we say hard drug abuse? What are those things we call drug abuse? Because they think it's just taking cocaine and all of these things that
No.
is drug abuse.
Okay. Okay. Well, let's before we talk about drug abuse, maybe we should talk about what are the drugs or psychoactive substances. All right.
Please go
Is that
ahead.
okay?
Please go ahead.
Okay. We may just say that psychoactive substances are okay refer to any substance that has effect on the central nervous system.
Okay.
Okay. Any substance at all that have effect on the central nervous system. Okay. And usually there is a delicate hemostasis, okay, equilibrium, hemostasis in the brain, in the brain chemical. So if something is introduced, it can easily disrupt the balance, you know, in the hemostasis of the brain. So any substance that affects the brain is a psychoactive substance.
Any substance
Or drug. Now they include drug of abuse or recreational drug, the cigarettes, the alcohol, okay, and even the over-the-counter drugs, even the drugs. Okay, people can say the so-called sleeping pills, the diazepam. Somebody may just say, I have issues sleeping. Okay, instead of going to the hospital for a doctor that is well trained to okay have interaction with him or her and okay and know what the problem is, they'll just start taking over the counter drugs. And even though those drugs are not supposed to be given by pharmacy outlets, some of them will just go and give. Okay, they'll do this, and those ones also they become addicted to it, complicating the problem. Okay, because I'm saying this because let me just say 80% of referrals I get for let's say they said they have sleeping difficulties, that they cannot sleep. When I say okay, they should come over, they will have interaction, discover at the background there are issues. Okay, and more often than not, the first psychological symptom an individual will develop when the person is having some stressors is difficulty with sleep. Sleep will go. All right. So they'll be struggling, and most time you will not see hardly will somebody see okay sleep problem stand alone. Something will call
there is always something that warrants
yes,
it.
something will call primary insomnia. Okay, hardly. Okay, is a diagnosis of exclusion. You look for everything, you will see, you now say it will be this one. All right. Okay, so you look for it, you now see that person has other symptoms, other things. It could be anxiety, symptoms. Sleep difficulty with sleep is just one of them. Depressive symptom. Depressive, okay, usually mostly maybe are women or even the men, maybe had issues with their spouse. Even if that thing has been corrected, check the phone on the spouse, find the person who was cheating, even after apology, because the the brain hemostasis have been distorted too. Okay, and person needs
So
to
there's a
meet us.
recurrence.
Not a far reaction. The chemicals have been distorted. So the person will need treatment. The sleep will, will persist. I'm not sleeping down. So until you go and address that thing, all right, okay, give something to help them sleep, but address that thing, give proper treatment for that thing will not be corrected. So when you say, okay, substances, illicit, non-illicit, some of them, the so-called non-illicit can also wreak havoc, because I said alcohol is permitted in society. But it's causing problems. We have patients, it's causing problems.
And we have a lot of people involved in this.
Yes, it's causing a lot of problems. So back to what you are saying, you are asking me psychoactive substances. Okay, substance abuse, all right?
Yes.
Substance abuse can be described as a maladaptive pattern of substance use that results in a failure to fulfill work, home, or school obligations. All right. Physically hazardous behavior, e.g., driving a vehicle recklessly, legal problems, e.g., arrest of disorderly for disorderly conduct, and having frequent arguments, e.g., with spouse. Now, what that simply means that substance abuse, is a term when we apply it to describe a maladaptive pattern of use that affects the individual's level of functioning. When someone start using these substances to the extent that it affects the person's functionality, there is the term substance abuse can be applied. All right. So, and these areas of level of functioning include failure to fulfill work, home, or school obligation, physically hazardous behavior. The person maybe driving. Most of here in Nigeria, we don't do driving offenses. Most accidents has been shown in Senna climbs to be caused by a substance. That is why maybe in UK or in US, if you drive roughly and police stops you, they check your breathing or check and perceive alcohol or see you with some substance. Wow, you are in trouble.
That could have been the reason.
Yes, that would be the reason. Because a lot of people die from road traffic accidents. So they frown at it so much. So such substance abuse can do that. Then legal problems. Somebody could be arrested for disorderly conduct. You look at it, smelling alcohol, smelling of substances, and recurrent interpersonal problems. Okay, e.g., argument, fights with spouse. Okay?
Dr. Kano, we have this set of people that believe in their minds, and they will confidently tell you that I take this particular drug or I do this thing. It's a way of calming me down. They believe that this thing help them to relax their mind, and they will only tell you it is only when I overdo that is when it becomes bad. What's your medical advice to such people that are taking these illicit drugs, substance abuse, and they say it is just for me to calm my nerves, stay relaxed, and stay focused? Some will even claim it helps them to stay active. What do you have to say to such people?
Yeah, what you said is just the truth, right? In fact, up to 50%, in my own estimation, of people who abuse substances use it to medicate. Okay, that's use it because of something.
The reason.
They say they have to calm down to do this. And what we call it in psychiatry and psychology is maladaptation. It's a maladaptive coping mechanism. All right. Now, okay, let me digress a little too for listeners to understand. The world is full of stress. Recently, I had to talk to some adolescents in a church about stress management and all that. I said, wow, that's best time to talk about stress. All right, because what we call stress are due to stressors. Okay, and stressors, psycho stressors described as conditions, situations of or events that put a strain on an individual's normal coping mechanism. Conditions, situations, okay, events that put a strain on individual's normal coping mechanism. Now, okay, what constitutes a stress is highly individualized. What constitutes a stress to you may not represent a stress, and is also in that individual is also due to perception. All right, some things a student, there are two students that may be writing exam. Even the one that is more intelligent may be stressed too much because for the exam because he thinks he needs to read more. Or okay, let me put it this way: somebody may be intelligent, will not know, may underrate himself and thinks the exam is too this thing.
Hectic.
Okay, and while somebody else who may just study and breeze through. Whether a person passes more than the other, it doesn't matter, but it's perception based, and okay, a lot of things. Now, there are ways of coping with stress. All right, so there are different ways. Okay, we can have emotional response with autonomic emotional response with autonomic reaction. We can also have other coping strategies. Now, I'll go back to you. I'm just going now. Coping strategy, okay, we have problem solving, emotional reducing and all that. But when you now come, there are some maladaptive, okay, ways of coping. Instead of people when they have problems, the problem solving is good. You attack it headlong, okay. You can decide to seek help, hello, consult someone, have a mentor, okay, seek more information about it, do all that in us, vent, okay, that's emotional reducing. Some have maladaptive and use of substances. I said all this to come to this place. Use of substances is one of the maladaptive coping mechanism. And sometimes it's not due to that individual.
Okay.
I said things earlier on. Someone listening may say, this guy was answering OP. No, I was saying when you were talking about team of this year's this thing,
yes,
that investing in prevention.
Exactly.
All right. Some of these people that are using drugs now to medicate in order to cope. All right. It has a lot to do with their background. You understand?
When you say background, how do you
I'm
mean?
coming. Okay. I have some patients that they are raised by their mom. Guys now. It's not as if only guys abuse females too.
In fact, a lot of them these days.
Yes. So you now come. I have two patients recently. Okay. One will say a guy has been abusing multiple substances and has affected the behavior, has developed psychiatric disorder. All right. They're not seeing me. Okay. I now discovered, I was asking, probing, I discovered that he never knew his dad. Okay. One of them now never knew the dad. The dad left the mom when he was 6 months, traveled abroad. Okay. So he's now growing fine. They talk sometime now. He's feeling shallow, now growing. When a male figure, an adult male figure growing up, okay, is like a role model for a male child. Okay, when the child is growing, when the child reaches adolescence, start facing stressors, okay, because around the adolescent period, a lot of things happen, including development of abstract thinking, cognitive development, and all that. Someone will appreciate. I need to work hard. I need to read. I need to pass exam. What is not a bed of roses? Some things are expected of you. Not only demanding for toys and asking for everything. All right. So now, when they are doing that, okay, they need a stable environment. Okay. Now, when they are going through some of those things, okay, if there's already a void, okay, they are feeling unappreciated. My father abandoned me. They don't just blame themselves for what happened. They are feeling lonely. Okay.
They miss that fatherly
Yes,
love,
nobody.
the
So
affection.
a lot of things. And then they now rely on what their peers tell them. Okay, try this. Oh, you are too dull. Try this. You make you this, you make you that. Okay. And some already may have developed, okay, some psychological conditions, maybe depression, anxiety, so they are using it to medicate. So talking about prevention, investing in prevention, apart from the ultra policies and other which are important, all right, from individuals, if society will know that, okay, a man and a woman getting married, okay, bringing up a child, okay, your action or inaction in raising this child will affect the well-being of this child in future. Okay, we should be, therefore adults should be careful. We shouldn't be reckless the way
In
adults in,
parenting.
yes, in parenting. Thank you.
Mm.
The relationship is so rampant. In fact, most,
Mm.
not always, most of the patients that are abusing drugs, there are issues. If the parents are still living together, I know that they are quarreling. The family, the relationship between conflicts, relationship about among the parents, non-existent. They always quarrel. In fact,
Mm.
one other patient told me, I use I use drugs. The baby is taking loud. I use all to, you know, drink to dull myself. I'll forget what is happening at home. There's
Mm.
no love there. There's no all this I'm saying is, do you understand?
Mm.
So it starts at the home. Now, these things happen because all of us are human. Africans are human, the way Caucasians, I mean, abroad are human. But in
Mm.
the larger society, they saw this and they now use laws and policies to try
Mm.
to mitigate the effect of this. Okay? Because in divorces and all that, okay, um, the system takes care of the child.
Mm.
Make sure the child doesn't fall. We make sure that the parents, wherever you are, you take care of the child. They make sure they bill you those
You
alimony
just have
fees.
to do
Take
it.
care of the
You take care
child,
of the child.
and then they can also, if whoever parent is there is not taking care, they'll take the child away. All
Mm.
right, adopt the first start. That's those are not even the best, but take the child away.
Mm.
But here we don't do that. So prevention should start investing in prevention. We should think about our religious leaders should talk about harmony, unity.
Mm.
There's a lot of fire in the society, a lot of disorderliness, a
Mm.
lot of we have a role to play. All right. We should emphasize, okay, the important things.
Mm.
Okay, not high fast track. Well, the society is going through a lot, and when people is something to really talk about. Then we also have to know that, so information. When I was growing up, okay, there was MAMSA. Okay, there was, I think we used to have an agency, whether they are still existing at the federal level, okay, that disseminate information. In
Mm.
fact, there should be radio jingles. I like what I heard now.
Mm.
Perfect, wonderful, because we need to have an alternative. um these children, young children growing up who don't
Mm.
know left from their right.
They should be aware.
Yes, they should have an alternative theory to
Mm.
what their peers are telling them out there.
Mm.
This is that. It's as if it's the norm.
Because they hear these things from their peers and they don't see alternatives to take them out of
Yes,
that
it's as
thought.
if the norm. Some don't know, some dabble into it. Just
Mm.
okay, do
I was told ignorance and all. There is another side, Dr. Kanu, that I want us to look at. If you're listening to us, it is still the issues on IKD 106.1 FM. And today, we're looking at this International Day. The theme for this year, 2024, is the evidence is clear. Invest in prevention, the World Drug Day. There are another category of persons, Dr. Kanu, that will tell you that they've dived into this substance abuse, and because of that they are so addicted to it, and they believe, they have the notion that when you're into drug abuse, you're into it, no way out, no escape route. This is your line of profession. With all sincerity, has there been cases of somebody who used to be an addict of whichever drugs and then was cured, was treated? I don't know what the right word is, whether they cured them, and this person is currently doing fine. Do we have cases like that? Because people believe it is not true. If you are in, you are in.
yeah. The truth of the matter is, um, it is difficult to
Mm.
treat.
Mm.
All right. That's
Mm.
why the theme of this year's this thing is up, investing in
In
prevention. You
prevention.
said something during your introduction that prevention is better than cure.
True.
It's more apt here because uh, in my years of practice, okay,
Mm.
as a mental health physician, treating addiction, okay,
Mm.
we call it dependence,
Mm.
and substance-induced conditions. Addiction is among the toughest to treat.
The
Okay,
toughest.
yes, because when one becomes dependent on this,
Mm.
addicted to it,
Mm.
okay, it has to do with prolonged use, okay, heavy use. It goes to reprogram the individual's mind,
Mm.
okay, reprogram the chemicals in the brain. Okay, to they become addicted in two ways. Okay, why? Okay, we have what we call positive reinforcement
mm,
and negative reinforcement.
mm,
The positive response for reinforcement infers those things that those drugs do for them
mm,
when they take it, do for them. That when they don't take it, they feel they are not okay. They are not themselves. Okay,
mm,
like it makes them maybe bold, high, okay, and some okay when they take it, it makes them eat more.
mm.
Okay, it makes them, and those that use it to commit crime. Okay, they just go and do those things. They don't do it as they say, challenge clear eye, quote and unquote.
You know if you do it with your clear eye,
Uh-huh.
your eye
Then
gets dirty.
the negative response that
Mm,
makes them go back take it is that
mm-hmm,
when they don't use it,
mm,
okay, I like the body revolts, their brain revolts, okay, like alcohol, you're dependent or addicted to it. When you don't use,
mm,
you have what we call withdrawal symptoms. You shake, seizures. The person like they take it. One of the ways we know that somebody has issues
mm,
with alcohol use, they will take it early in the morning. Without the early in the morning, call it eye opening. They won't
mm,
feel themselves. They're not themselves. You understand? They
mm.
won't feel they
They
are
say they
not.
want use and look front.
Yeah. So they some those things without using them, their body will revolt. They won't be, they shake, they do this, they do that.
Mm,
So they need to use it now to function.
mm.
You understand? So having said that, is it impossible? No,
Okay.
to come out of it.
Mm,
It's difficult, but not impossible.
mm,
But the person has to be determined. Okay. Drug taking behavior, most times,
mm,
all right, people around the person knows the person is abusing drug.
mm,
Okay, so they take you to that person. They may force the person in,
mm.
but you can't force the person to stop. So you
Definitely.
have to get the person to a place. Usually, when a person present with drug use and come, it's not only that one diagnosis. Okay, the addiction problem is there. You
Mm,
now look for the behavioral components. Person may have psychosis. The person may have depression,
mm,
anxiety, other things. So those behavioral components are easy to treat. As I
mm,
said, you
mm.
clear them 2 weeks, 1 month. Then is the addiction, what we call rehabilitation, that takes time. All right. So you have to bring the person to a place where the person there are methods, there are ways we use psychologically. We
Mm,
call it stages of change. Initially, most of the time when they come,
mm,
they don't believe they have a problem with use
mm,
of drug. We
mm,
call it the pre-contemplative stage. Okay. Then with time we were talking to them. So now they start thinking, okay, could there be a problem? Am I there? Is there a problem here? Contemplative
mm,
until a place where they now decide that okay, make a decision.
mm,
Okay, I want to stop. Okay, that's an important stage,
mm.
but that's not all important. After making that decision, next thing is to follow you with action. So regular action. Usually tell them one day at a time.
Mm.
All right, because you see why I said it's difficult.
Okay.
Most of the people that eventually are 10, 15 years, 20 years or beyond sober will never tell you that um, the craving,
Mm,
that the strong desire to use drug, that it
mm,
ever stops. No, you know, but they'll just tell you each day they make up their mind
mm,
not to use. So when part of the rehabilitation process when people come in, okay, is we'll arm them with skills that they will use to at the height of those craving,
mm.
at the climax of the craving, what they can use to hold on.
Gets them busy, keeps them
Yes,
busy.
what they can use to hold on, what they drink, what they have to delay going to take that. And that
Mm,
climax will pass. They say, then they will they will do that daily.
mm,
Then, but the more they hang on,
mm,
okay, the more the intensity of the craving will reduce. All right. So it's difficult but if anybody, like sometimes, you said, we used to, we work on their mind,
mm,
okay. Don't give your power to this thing. Don't feel hopeless about it and help. This thing, I tried my own thing.
mm,
Just have to a place where they will believe it's possible.
mm,
It is possible.
mm,
Is that the EBL end? No, it is possible.
mm,
So you build them up, they start working, and then they will have what we call accountability figures that will help. All right. Yeah.
Okay, thank you, Dr. Kanu. If you're listening, you can be a part of this conversation. If at all you have questions to ask my guest today, he's a medical health physician from General Hospital Ikorodu, and today we join the rest of the World Health Organization, in marking this important day, International Day Against Drug Substance Abuse and Illicit Substance. In other words, you can call it the World Drug
Drug day.
Day. Now, another part, while we talk about the prevention, that is the major reason why you're here today, why we should prevent it. You talked about the society, they have a role to play. Part of your words, I was able to pin down the family being a major factor to consider in prevention. Then religious bodies too needs to start doing more than what they are doing currently. Now, let's hit the nail on the head, Dr. Kanu. Prevention of hard drugs. There are a lot of youths out there, there are teenagers out there that are even thinking of venturing into this. For you, as a physician, a medical practitioner, what would your advice be to those people? Don't go close to these drugs. How dangerous it could be. Please help us know these things.
Levels of prevention. We have primary, we have secondary,
Mm,
we have tertiary.
mm,
Primary prevention is preventing someone from coming into contact with the substance.
okay.
All right. Well, exposure. But when you think of maybe the substance itself, well, somebody can be exposed. A lot of us were exposed, but
Mm,
they didn't continue
mm,
using. Okay, exposed to a substance. Okay, by sensitization, by enlightenment,
mm,
telling them the dangers of this thing.
mm,
Okay, telling them that it's better to stay away.
mm,
You are not. You are that. You whether they call you Jew man, it doesn't matter. I've used myself as an example.
mm,
Okay. Of course, times have changed. All right. Um, in the university 100 levels, okay.
mm,
First time um, I saw cannabis, marijuana.
mm,
First time I saw in the room like that. Room usually they pay. Usually most universities in a public university will pay 100 level students with final year. So those final year students are already into. They said they'll offer you.
mm.
I refused. Say Jew man. Jew man. Why the another 100 level started following them? I
Mm.
don't know whether he graduated. So 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 bearing the shame because people are under pressure
Mm,
to belong. Peer pressure
mm,
to belong.
mm,
Okay. If you don't, they discriminate against you. I wasn't afraid of discrimination for whatever reason. Okay. Okay. I don't want to follow you. I don't want to follow you. It's as common as if you go to the gym, even in the school, you're on your own. No, you want to
mm,
gym, you want to just keep fit.
mm.
They will wrap something and they will pass. They smoke, they pass, they smoke.
They call it puff. You take a puff.
So they came to me and said, pass.
Mm.
I mean, who is that Jew man?
You can
Okay.
imagine that.
So some people will feel timid about it.
Mm.
But they'll look at you, they will respect you from this guy is strong-willed,
Mm.
and those people who are already addicted to this won't tell you about the struggles they have. They just want you to,
Join them.
yes,
Mm.
so the young people need to know that it's not fashionable to use these things.
Mm.
It is not.
Mm.
Now I've seen a lot of things. Bright people, brilliant people,
Mm.
young people, and most unfortunately in our higher institutions, all the high institutions, I won't call even the private,
The public.
religious,
Mm.
those ones, those that their parents have allowed to spoil, will think they were looking for people to spoil in quote, okay,
Mm.
looking for magic now when they're already adults, try to put them in, and those will come now and bring those that are from quote guild homes who have not tested this one when they
Mm.
now come in. So they initiate them.
This is it.
All the all the all the religious public schools, you
Mm.
see you see people they expose, they get who the parents say this guy was good before he came to this school, this guy.
Mm.
So it starts with the home. Let them know, and I said also, let them know there are stressors. Poverty is a problem. Okay, I'm talking about what President Tinubu said. i
Mm.
hope i hope our highly esteemed president knows that implementing a good minimum wage in society will help even in this drug fight.
Mm.
Tell you,
Mm.
poverty causes chronic stressors. When a child cannot get whether they don't have enough food to eat,
Mm.
parents cannot afford even paying school fees, buying books. They are worried about. They want to cope. They want
Mm.
to do other things.
Mm.
You understand?
Yes.
And You know, abroad they also pay minimum welfare to people who cannot really work. UK, that's why some has every system, every method has its own problem. I understand in UK, there are UK citizens have not their grandparents didn't work, because on welfare. And welfare is living wage. They can afford food, they have not work, they depend on welfare.
Yeah.
So, but it helps the society, and that's why UK government, they are taxing so much. I'm not saying you should be taxing so much so that they now use it to spread,
Across
those who
for the
cannot
wages.
afford. So a lot of things can, the young people need to know that Nigeria now, I used to tell young people, by the way, hold on, don't be afraid. Don't be hopeless. No matter how the naira gets, no matter how bad the economy is, hold on to your dreams. Nigeria is not the only country in the world. Hold on to your dreams. Don't, because once they start, you know, mixing it with substances, it creates problems.
Get worse.
It creates problems. Okay. I have a lot of young people, they say they want to do music. What they see is a vice. They see people that are
The
smoking.
entertainment industry also have a role to play in all of this.
Yes. Yes. And even, yes, music, Nollywood, they should not portray drugs. By the way, do you know, when we were young, I'm not so young anymore. When we were young, the guy that was, thank God they banned cigarettes, advert.
Yeah.
The guy that was advertising this Morris, handsome guy that looks successful.
Yeah.
He died of lung cancer, serious lung cancer. And before he died, he was gracious enough to, do a video, tell people don't smoke, don't. But all those manufacturers will not let people see.
They wouldn't promote that one.
They won't.
They won't
So
promote it.
the other thing, young people shouldn't think that we have a lot of problem, serious problem in Nigeria. That it's only when people smoke and do other things. I won't say the one they do with the internet, stay awake at night, that's when they succeed. Because there's a relationship between Yahoo, in fact, research we should done, and drug addiction now. Because some of those people that, we have different time zones between Nigeria and US, so they need to stay awake at night to, and that's why they are using what they call ice
to keep them awake.
So to keep them awake. I've once managed a patient, young guy, he made millions, he built a house. Of course, he didn't also grow with the mom, the dad. Okay, he built a house. Okay, addicted to crack. Okay, another. I've seen many, in fact, more than 60% of young people I'm treating that have drug issues are into all this other, we call it Yahoo, if it's permissible to say.
Scam.
Yes, they're into. So some people are saying, is it a cause? You deprive people of their money, eventually you break down. So there are a lot. There's health is wealth, and mental health is the most important aspect of health. And of course, we know the definition of WHO. Okay, that health is not only the absence of disease or infirmity, but a state of complete physical, mental, emotional, psychological, other spiritual well-being. All right, because you may be looking at someone, not sick, not fever, not
looking good physically,
it's not functioning. There's a problem. That's a problem. You understand? So when WHO realized all this, they're giving, a lot of attention to mental health. Okay, like soon, September now, we'll say Suicide Prevention Day. Then October, World Mental Health. Because it causes a lot of problem. Abroad is many things, many things. And with the larger problem it causes, what we're talking about, check crime, a lot of crime, a lot of when they were showing us some years ago, they broke into Boko Haram. Then part of the thing they saw was wraps of hard drug, marijuana, all that. Are we surprised? You go to crime scene because they use these things to do. Do you think it's easy to hurt another human being? Okay, so when you use those things,
takes away your consciousness.
Yes, it alters. So crime is affecting lives. It leads to when a parent works hard, and the child squanders the money on drug, okay, it affects the parents, it affects the economy, it affects the
Dr. Kanu, let's
society.
take
Yeah.
this call.
Hello.
Yeah, good morning.
Yeah. Yes, good
This
morning.
is Mustafa NXF from Alagbado.
Thank you for calling us from Alagbado.
See, I just wake up, but when I heard this program, I'm so happy. You see what's happening now? UK, US, Germany, among other major countries, have decriminalized marijuana because of its strategic importance. Most especially fighting some untreatable problems like cancer, among other dangerous diseases that kill person. So, as a result of this, I don't know why Mr. President now determined to fight marijuana. We know from confessional hostility, we discovered that those who want people to take drugs are the people, the oppressors. You know why we call them oppressors? They know say when person take drugs, it will repel or resist their hostile interest. That is why they criminalize some hard drugs. Although some of the hard drugs are so dangerous, but I only use to marijuana and tobacco, because you cannot fight cancer without marijuana and tobacco.
Okay. Please, can you hold on for the doctor, Doctor Kanu?
Are you aware, sir, that tobacco can cause cancer? Are you aware?
You can never.
Cigarettes can cause cancer.
Sir, wait for me. This guy, the tetracycline and filagi, 70% contain tobacco.
Okay, you know what? You know what, sir?
You're wrong, sir.
Sir,
let's just address?
Okay, let's address this. You know what we will do? Please, I would like for you, Dr. Kanu, to just please orientate this caller, because I want to believe he's still not very aware of some things.
Yes, maybe it's even high. He is. I'm not aware. UK, okay, has legalized cannabis. I know some states in
those were words flying around.
United States, legalized it. I know Netherlands legalized it.
Sorry,
but
hello.
Yes.
Good morning.
Yes, good morning. Thank you for calling.
This is Babade speaking.
All right, talk to us, Babade.
Well, you can see for yourself how rotten this society is like. If a medical doctor who is an expert, in all these things you are discussing, is telling the whole world what he knows about this marijuana and the rest of them, and somebody is arguing with the medical doctor, of course, you can see from the way the man is sounding, that something is wrong somewhere. What I'm saying in essence is that the young man there should please not hesitate, to tell everybody, including that man that called last, the blunt truth. And in addition,
yes, please,
government should make effort, not just through this radio, whatever. Let us have contact. Maybe I keep talking about the National Orientation Agency that has a lot of work to do. When it comes to issues like this, I think the National Orientation Agency should be made to go around the street. In my area, I'm so sorry. I saw a guy who took this drug, and he was just coming staggering, and then he fell. The next moment, I saw that same guy being carried on a bike. He was unconscious. So how long shall we continue to go like this in a civilized society?
Thank you, Babade.
And in any case, thank you, my dear.
Thank you because of our time. Yes, Doctor, over to you.
So even the countries, the few countries I mentioned that legalized it, they are even reviewing. Netherlands for one, because in every progressive society, when they make a decision, they keep reviewing. It may be a few people who are not even reasoning very soundly that
claim about that.
Yes, compelled others to. They are reviewing. It's been shown that it's affecting their young people. Cannabis. The long-term effect of even cannabis, apart from the obvious psychiatric illness, is that it causes a cognitive condition where the individual doesn't care about anything. Okay, will not work, will not do anything, just get high, sleep,
and that becomes the order of the day.
Nothing, will not care about, they are lazy, they are not functioning. They are somewhere like Netherlands, they are discovering that increasingly in some. The young guy that said, the man that said, that cannabis is used to treat, cancer. And he mentioned, surprisingly, he mentioned cigarette. Well, something in cannabis can help you reduce pain in cancer, severe pain. There are some drugs, severe pain, and it's even allowed and prescribed in end stage. End stage. He said, fine, end stage. They believe they're going to die anyhow. Some of those things, not give them so that they don't have suffer to their death. All right. So he doesn't. I'm surprised he doesn't know that cigarettes. Cigarettes. I said it's not illicit. Cigarette can cause cancer right from the mouth, nose down, all side, because it's like you're burning. If you go to your kitchen, you've been cooking for a while, depending on what you're using, you'll see like chimney, see dark, smooth, deposited. So what causes cancer is just a distortion, disorganization of normal cells of the body.
Dr. Kanu, we have to go, but then I still see all of the calls coming in. I think a lot of people have something to say, but unfortunately, we have just 1 minute to leave the studio. Please, your parting words in just 1 minute, Doctor, please.
Drug use, psychoactive substance use will not help anybody. Okay, you can't come in contact with anything and it won't affect you negatively in one way or the other. Affect you one way or the other. But the effect of drug is terrible. To the source is terrible. And it's high time we start doing anything about it. We know there is increasing moral decadence, but we can start from our niche. We can start from our family. We can take care of our loved ones right from cradle. We should take care of them. Adults should stop child abuse. Child abuse categorized into emotional abuse, sexual abuse, physical abuse, neglect, because of sometimes substances too. The adults neglect the needs of their children, and in order to cope, these children will close to psychoactive substances in future. So it's possible to prevent. Prevention is better than cure. Thank you.
Thank you so very much. That is how far we can have it today. There is nothing that justifies substance abuse, be it what you drink by alcohol, what you take by drugs, or what you inhale or even smoke. Remember that these things are deadly, and gradually one begins to fade away. This is how far we can have it today. We have joined the campaign from the World Health Organization propagating the gospel that abuse of substance is a no-no. Please know this and know peace. I am Opayemi Adebambo. Until next week, Thursday, I will meet you in peace. Thank you for joining us.